This is an ECG of a 47-year-old woman seen in the office of her general practitioner complaining of palpitations. She describes the palpitations as the sensation of isolated, irregular pulsations in her chest, more often occurring in the evening when she is tired or stressed. Otherwise, she is well. On examining this ECG, we first want to assess for the presence of P waves. In this case, it is often best to start with the long rhythm strip seen at the bottom of the ECG tracing. Here we can see that there are P waves preceding each QRS complex, with an average rate of about 84 beats per minute. When we look closely at the morphology of the P waves, we can see that there is a repeating pattern of 2 positive P waves followed by a negative P wave. The positive P wave is also positive in leads 2 and AVF and lead 1, suggesting that the P waves originate from the sinus node. The negative P wave is early or premature and is negative in all the inferior leads, suggesting that it originates from the lower part of the atrium. That is why these P waves are also positive in the superior leads, AVR and AVL. When premature beats occur every third beat, as in this case, we call this a pattern of atrial trigeminy. Now we examine the sinus P waves a bit closer, and we can see that they are normal in the inferior leads and in lead V1, suggesting that there is no evidence of left or right atrial enlargement. In addition, the sinus PR interval is normal. The QRS axis is positive in lead 1 and positive in AVF, suggesting a leftward inferior axis, which is normal. Because the QRS complex is narrow and sharp, there is no evidence of any intraventricular conduction delay. The voltage of the QRS complex in the limb leads and in the precordial leads is normal, suggesting that there is no evidence of left or right ventricular hypertrophy. Here, there is no evidence of any abnormal Q waves, and there is normal R wave progression in leads V1 to V3, suggesting no evidence of infarction. The ST segments are normal, and the T waves are positive in lead 1, AVF, and V2 to V6, showing a normal pattern of repolarization. Overall, this ECG shows normal sinus rhythm with premature atrial beats in a pattern of trigeminy.